We are now being recorded. And again, welcome everybody to the March 23rd, 2021 New Jersey DD Partners Virtual Town Hall. It seems a little bit surreal that we're here again in late March, just over a year from the time that the pandemic really became a reality for many of us. And a lot of the changes that we're talking about and that we've adjusted to over the last year really started to come into play. So I'm glad that you guys could join all of us here on the call. Like I said, just a couple of quick housekeeping things before we get into the meat of the night. You are all coming on mute later on. I'm going to give you all the option to unmute yourselves when we have some Q question, answers, discussion. We're going to try to pass some resources around that we think might be helpful and timely. And once we get into that, also, if you feel like you want to go on video, you can. If you want to put any questions into the chat box at any time, feel free to, and please do. We encourage that. If you have a comment, a question, a resource to share, chat box is the place to put that. If you submit any questions, we'll get to those as we go through. I want to give the same preface that we've been giving the entire time that we've been having these virtual town halls. And that is things are still changing, sometimes day to day, sometimes week to week. So we may not always have all the answers, but we want to hear the concerns that people have so that we can tailor the work that we all do to meet the needs that you all have. With that, I want to introduce tonight's co-host. I am Michael Brower. I'm managing attorney at Disability Rights New Jersey. I work on our community inclusion team, which addresses community inclusion or barriers to community inclusion for folks with all different kinds of disabilities. I am joined tonight with my co-host, Colleen McLaughlin, Associate Director from the Boggs Center on Developmental Disabilities, and Mercedes Witowski, the Executive Director of the New Jersey Council on Developmental Disabilities. And you'll hear from them a little bit later. As I have been doing through all of our virtual town halls, I want to once again plug Disability Rights New Jersey's COVID-specific website, where we have amassed what's now including some historical and a lot of current information that's valuable to you as a New Jerseyan on different resources, self-advocacy materials, latest bulletins, and links to important websites, and including the archive of the town halls where we may have talked about a question that's still relevant today, even if we talked about it first time about a year ago. That's drnj-covid.org. And that's up on the screen. The recording from tonight will go up on that website. If anyone wants to go back, if they missed something, we'll also put the slides up on the website as a PDF. In case you want to go back, you don't have to furiously keep up with taking notes. I know sometimes we talk pretty quick. With that, I want to pass it over to Colleen.
Hi, everyone. It's great to have the opportunity to listen to you all tonight. We just wanted to make sure you were aware of our 2 new documents focused on the COVID vaccine now that it's available to caregivers and people with disabilities. So please check that out. It includes a fact sheet about the vaccine as well as a social story to help people understand the process of getting the vaccine. And we also wanted to make sure you were aware of the special needs vaccine clinics that are coordinated by Autism New Jersey. If you'd like to learn more about that opportunity, please visit their website. You can see it on the screen down below. Thanks, Michael.
Thanks, Colleen. I appreciate those are some helpful resources. And again, that website will be coming up around later. And one of us may even be so good as to drop it into the chat box for anyone who wants to copy and paste the Autism New Jersey and VNA vaccine pilot program. But again, the theme of the night, and it's worth reiterating, is we want to hear from you. The main goal that we all have from this, in addition to giving out a couple of resources that we think are relevant and timely, things like vaccine information, and we'll get to a few others as we go. But what we want to get out from all this is to hear from you. What are the issues that are currently affecting people with developmental disabilities, and whether they're adults, whether they're children? Where are our advocacy efforts needed? What are the things that we're not hearing about? Because we've heard of all different kinds of topics, everything from hospital visitation policies that restricted the access of caregivers. We've heard about things like discriminatory medical rationing policies from these town halls. We want to make sure that we stay up to date. And this is our way to hear from you, the community, on what issues are important to you now. We also want to hear what's working. If there's something that's really great that you're experiencing, we want to know what that is too. So if you have questions, if you have comments, if you just have a concern, I'm worried about what's next. Again, go ahead, put that in the chat box. When we get to the discussion sections, I'll switch off the mute button so anyone can talk or put themselves on video if they wish. You can also submit a question to questions@drnj.org. Jill will be keeping her eye on that email box as we go, and she'll be reading out any live questions we get. So again, you can put a question in the chat. You can raise your hand when we get to the discussion section, or email your question to questions@drnj.org. Thanks, Jill. That's in the chat box too if you want to copy and paste. All right, we're going to split our discussion up just to keep ourselves organized into two sections. First, we'll talk about adults who are 21 years old and older. So that would be people who are eligible to receive services through DDD. And then after that, we'll talk about issues that are facing children who are under the age of 21. Some issues are across both populations. So if you feel like you've got something that applies to both, don't feel like you have to sit on it. Go ahead, jump right in the chat, jump right into the audio section, and go ahead and speak up and let us know what you're thinking, what's on your mind. Again, good, bad, or otherwise, even if it's just a concern or a question you might have that you want an answer to. Something that if we don't know the answer, that at least lets us go and find out. So we're going to start off with adults who are 21 years old and older. And I told you we're going to plug a couple of resources. And since we're going to start talking out with adults before I open up the discussion, before I forget really is what it is, I want to give us a couple of COVID specific resources that are important. One, there have been some really major announcements from the Division of Developmental Disabilities over the last weeks about the reopening of day programming and changes to residential visitation policies. Those changes have, built on top of other changes that have built on top of other changes over the course of the last year. We have heard, various kinds of concerns of providers who may or may not be sticking to the rules. If you have a concern, there's a couple of things you can do. If you think that either your provider or your loved one's provider is kind of varying off of the guidance that's coming from the state, first of all, you can always call Disability Rights New Jersey. I'm going to put our information in the slides, so you'll have that on your screen. You can come back to the recording, come back to the slides to download them. You can also always go to our website, drnj.org, to get in touch with us through our intake office. Let us know if you've got a concern. We can either give you some advice, point you in the right direction, depending what the problem is. A lot of things we can resolve that way. You can also, if you prefer, or in addition, if you'd also like to get in touch directly with the Division of Developmental Disabilities at the state, they have a dedicated COVID-19 email address, ddd.covid19@dhs.nj.gov. Again, that's up on the screen there. And the division is always, communicated very clearly with us. They're interested in hearing about any kind of problems, because the same way that we want to hear from you about things that are going wrong, they also want to hear about things that are going wrong. I think that the spirit is of cooperation and wanting to repair those problems when they come up. And again, it's worth reiterating, because the vaccine is such a hot topic, that Autism New Jersey and the Visiting Nurses Association are offering a special vaccination pilot specifically meant for adults with developmental disabilities. The website again, autismnj.org/VNACJ. And there are, from what I understand, available vaccine appointments for adults who are over the age of 18 with a developmental disability. There's my adult resources. I wanted to get them out there. It's kind of my one way. I want to get rid of it one way right now and switch over to our discussion portion. So I'm going to go ahead and change the settings so that you all can unmute yourselves and speak up if you have any questions. Feel free to use the chat to answer any questions or ask any questions. If you have resources too, feel free to share those. And for a minute, I'm going to shut up. So if anyone has anything, go ahead and speak up.
Michael, this is Barb.
Hi, Barb Coppins. How are you?
Good, my extra neighbor. I want to mention about that I've done the video on about the COVID-19 and about the vaccine. So we want to let people know that they can go on to the ARC New Jersey's website, and it should show the other website on their website on the ARC New Jersey.
That's great, Barb. And could you tell us all a little bit about what you would get if you watched that video?
It would to help people with disabilities to be comfortable, like when they go for the COVID test, that'll help them to learn and how they would do it when they do the testing, so they can like relax and you know, they can have someone hold them by their hand on their side and all.
That's good to know, Barb. Thanks for sharing that. And I think that's an important thing. A lot of folks are nervous
Yeah,
when they go to get a vaccine, and it's sometimes in a big environment, sometimes it's busy, sometimes it's bright,
yeah,
can be a little hectic. So knowing a little bit about what to expect could probably make all of us feel a little bit more comfortable with going through that process. Thanks for
right.
sharing it.
That's why I thought I would mention that. I did the video. I've done 2 of them.
That's good stuff, Barb. Keep it up.
Oh yeah, thank you.
There you go. I just dropped the link in the chat for anyone who's interested in looking at that video, watching it, or sharing it with someone in their family. That VIMEO link in the chat there is for the video Barb just talked about.
So hi, Michael, it's Mercedes. I just wanted to just say hi to folks. And I know that there's been in the last 2 weeks, a lot of information that's come out from the division on day program reopening and the residential visitation policy changes. So in addition to the other items you have on the screen about vaccination rollout, whether your son or daughter or you yourself are eligible for vaccines, where to get vaccines, best way to get vaccines. And then on the summer programming, I know day camps and overnight camps and have been questions that we've heard through various meetings at the New Jersey Council on Developmental Disabilities through the Family Support Planning Councils. So those 3 topics are, I'm sure people have something to share on, maybe not all questions that we can answer, but certainly to understand where people are at right now, what you're thinking, and how you have maybe experienced something that would either be helpful to share and kind of relay what you're going through, or help someone else who may have a similar situation. So we don't have shy people. I looked at the participant list, so please unmute yourself or raise your hand and we'll unmute you if you don't know how to do that.
This is Audrey Camel. I have a question.
Go ahead, Audrey.
Okay. So I understand I have an adult daughter who lives in a group home and goes to a day program through DDD. And I understand the day program can still not open because of the, it's the yellow level in that area. Okay. I don't understand why DDD is not requiring direct service providers to be vaccinated, because it seems to me that that's at cross purposes. So can somebody explain that?
Sure. So let me make sure I understand the concern, and I'm just going to kind of say it back to you to make sure I get it. Is that okay with you, Audrey?
Of course.
Great. Okay. So your concern is that because of the high level of transmission in the day provider's county, the program isn't allowed to reopen yet. And the DSPs, I'm assuming you're talking about the people who work there? Like
Yes,
the staff who work there?
There and at the group home
Okay.
are not required to be vaccinated, even though the vaccines have been made available to the workers. Some are choosing not to be vaccinated. And it seems to me, if you can require that children have their routine vaccinations before they attend public school, it would be a reasonable request, given this is a pandemic, that people who are working with this very vulnerable population get vaccinated or not work in a direct service position.
So Audrey, it's that is a concern that I think a lot of folks in this field have had is when we've seen vaccination rates at different places, whether that's in a nursing home, in a developmental center, in a group home. I think we've seen across the board pretty much that residents get vaccinated at a much higher rate than staff do. There seems to be a lot of hesitancy on behalf of staff, and it's something that I know that different organizations have tried to address those concerns in different ways because they come from all different places. I don't know the answer on why. That's one of those ones where we don't know the answer, but a valid concern for sure.
So it's Mercedes. I think considering that the vaccines that are currently available are for emergency, were approved by the Federal Drug Administration as emergency use authorized, and they only have that emergency use authorization. We do definitely have a situation where agencies, providers, and the state cannot require vaccinations. So whether people choose to be vaccinated is, again, their personal decision. I would hope that the decisions will get to a point where people will feel not only safe themselves, but understand that being vaccinated will keep the people that they support safe.
And
Go ahead.
go ahead, Mercedes. I just wanted to add when you're done.
Oh, go ahead.
Okay, so I just sort of want to dovetail on what Mercedes said about the emergency use of the vaccination has led employers in all different settings to be hesitant to require employees to get the vaccine. And I think that there also has been, people have been grappling with whether or not they could legally do that. And as we've moved forward, I've understood from DDD with respect to the developmental centers in particular, that they had made a decision that rather than requiring the vaccine as a condition of employment right now, they were going to use other strategies to encourage staff to get the vaccine. So I think there's been a large push, at least in the developmental centers, also in the state psychiatric hospitals, to really provide education for staff where there was vaccine hesitancy. And there are different reasons for vaccine hesitancy. And so some of the outreach and the education and training that they were doing around the vaccine was to address some of those issues related to vaccine hesitancy. My dog is acting up in the background, so I apologize if he's loud. I don't know how to mute him without muting me. The other thing I just want to say is I think we are moving to a point where experts, and I am not a legal expert in this, are coming to the conclusion that the vaccine can be mandated for certain employees at some point in time. But that's really going to be I think, a provider-based decision at this point in time, not from the state. And, while you were asking the question, I just did a quick Google search, and a New York Times article on this came up, and it looks like some, for example, some of the nursing home chains are starting to require vaccines. They had not prior to this, and they're giving people a period of time, May or June or whenever. So I think that individual and private employers may start changing their position on that. We'll have to wait and see.
This is Lauren. I just wanted to mention that even if people want to get the vaccine, it is really not available. My daughter is medically fragile. My father is 1A on all the lists. He was on the senior line an hour and a half. The only option they gave him was in Gloucester County. And, so he basically said, okay, so my option as an 82-year-old cancer survivor is a 90-mile round trip. So that's the bigger issue, is even if families and providers and DSPs want to get the vaccine, you can't.
Yeah.
I recognize that that's a huge issue throughout the state, but for this particular agency, they had I don't know how they arranged it, but they had vaccines. All the group home residents that had consent were vaccinated. They had vaccines available for all of the staff members, and they offered it to the parents of the residents. I got vaccinated already. My daughter's father was vaccinated. And if you're wondering how I got that, I can tell you that back in January, when they opened it up to 1B, I signed up with the state the very first day. 2 weeks later, I got an email with the link to schedule. And, you know, and I know not everybody has that ability to sit on the computer and, you know, sign up right away. But in any case, you know, the vaccine is available to the direct service providers that work for this particular agency. But I do understand and appreciate the bigger picture of the lack of availability to so many people in the state. And I'll shut up about it now.
No, Audrey, no, don't feel that way at all. It's just I think we're at a really change. Like, I think both Mercedes and Gwen touched on this. Like we're in we're at the top of a wave, a different kind of wave than we've been like so scared about for all this time, but a different kind of wave where like things are still changing. We're still in this rollout stage. This is a new thing. I do strongly suspect we're going to see some changes on mandatory. Just, you know, Gwen mentioned it's already starting to be some rumblings in New York. But I think that's, again, one of those things we don't have there's no hard answer to, but it's something that we can start to look at a little bit closer, because it's always going to be new issues for us to address as we go forward through the, you know, whatever stage of the pandemic we want to call this one, the end of the beginning. I'm seeing a couple questions in the chat.
There are a few questions in the chat. Abra is asking, would like to know if there is any guidance out regarding how individuals will be found eligible for the day programs with reduced capacity. Second part of her question is why virtual services are not required once in-person services resume for those individuals who are not comfortable returning to day program.
Okay, so we got a two-part question there. And the first one's about guidance from the division, I'm assuming, on how individuals could get back into one of those spots as those day programs start to reopen.
I'd be happy to take that, Michael.
Mercedes, thank you so much. That's good, because I was just thinking if I could point to one of the links, but go ahead and take it away.
Sure. Well, there is guidance, and if you want to put the guidance up in the link, it's quite lengthy, but there is written guidance. There was input from providers, from individual family members, from individuals with disabilities into that guidance when it was initially issued. And the division has left it to the provider to, you know, except for now the current situation where they have to be, you know, they can't be in a red or yellow zone, right? I think it's red or yellow. I don't know how the colors exactly, but they have to be in a zone where they're allowed to reopen. That's the only decision that the state has made. Everything else is really within the guidance and left to the provider in terms of assessing, completing an assessment with each of the individuals. And if you had an assessment done prior to the first reopening, I should say, that the provider is supposed to reach out again and review that assessment, include some additional information that was in the most current guidance on reopening. And then it's up to the provider to determine, based on many factors like ability to return, transportation, that they then will come up with a plan as to how many people they can let back in up to the 50% capacity that's currently the number. So it was 25% in the first reopening. It's now 50%. And it's that the provider's determination based on everyone that had been attending their day program and how they have responded to the assessment questions that were asked. In terms of The second part, if you want me to keep going, Michael, on virtual
Please do.
services, they are not required because, again, the state has left it to the provider based on their ability to provide a level of virtual services. We hear some providers are doing an outstanding job. Some are trying their very best, and some have, decided that they don't have the capacity to offer virtual services for a variety of reasons, and so they have not moved in that direction. The fortunate thing is because there are providers that are offering virtual services, you can make a decision if that's important, if for yourself or your loved one, that you can contact your support coordinator and add a virtual service option during this time period when the provider may still be closed, or at any future time. So that is something that the system is flexible enough to offer, and I think some people have already taken advantage of that. I hope that answers Aubrey's questions.
And Mercedes, I'm going to tack on to that. I think that something that, there's going to be a lot of things that we take forward from the pandemic that we end up sticking with after the pandemic is long over. And I think virtual services and, even virtual meetings like this one, where folks would otherwise have to drive across the state to sit in our office and talk to us. There's going to be things that are virtual that do stick around because they're popular, because people want them, there's demand for them. So that's something that I would be pretty surprised if we don't see at least a couple of virtual programs stick around long after this is over.
And then Eber has a follow-up question, was how does that meet the needs of all individuals with disabilities? And I think that, if we're first off, if the state is only allowing now 50% of people to return, we know that this does not meet the needs of all people because not everyone who was attending day programs can return to day programs. This is a start in that direction. And some agency providers and day program providers may decide not even to open at 50%. They can open up to 50%, but they may opt for a smaller number. We saw in the first round of reopening, some day program providers opted not to open at all, even though they were permitted to open. So I think that's a conversation with your day program provider. And again, I'll go back to your support coordinator because, many families, and we've heard this, can't function, cannot exist when their child is not enrolled in something and is not actively engaged in something that they enjoy, and that's something that allows that family, that parents to work. So I would encourage you to go to your support coordinator to see what other options are available. We have had a couple of town halls on kind of reimagining services and looking at what other options do exist. And we had some great parents talk about that, individuals with disabilities talk about that. And if anyone wants to pursue that conversation further, please just drop something in the chat. We'd be happy to set up some time to explore, but your support coordinator should be a great resource in that regard.
And that's a great point, Mercedes, is that some of those, and the titles were Reimagining and Reopening, and they are from the summertime, available on drnj-covid.org if you want to go back and rewatch some of those. Colleen did a few presentations on really just getting creative and making a day program that doesn't fit inside 4 brick walls, right? That may be custom tailored to fit your needs or your loved one's needs. So definitely worth it if you're looking at kind of seeing what will be new. What will be different. Some people don't want to go back even as individuals. If they went to a day program before, going back to something with 4 brick walls maybe isn't for them anymore. Something else, and again, I'm just going to build off a little bit on what Mercedes said as far as providers maybe choosing not to reopen at full capacity. Remember from what the guidance says right now, at least on DDD programming, on day programming, is that the opening status and even the 50% capacity depends on the color code of the county where the program is located. And that Cali score, they're calling it, that can change week to week. So if there are high numbers in a particular county one week and the Cali score goes up, that might mean some day programs close on a Monday after getting notified on a Thursday. So it's a little bit of a quick flip. And some providers may not be ready to do that. And some families or individuals may not be ready to do that. They need more stability and may not be able to flex when the numbers change and a county goes from, say, green to yellow or yellow to red. So it's something to keep in mind as you're thinking about what's right for you. Your flexibility to kind of roll with that as things change week to week. We've taken a question from the chat. I want to go back to the kind of the live audience, so to speak. Does anyone want to unmute themselves, come up on video or both, and let us know if they have a question, a concern, or a thought? All right. Give that a second and go back to the chat while we wait.
Yes, there's a few resources that have been dropped in here. Bree mentioned Liberty Lake Day Camp is having an informational session tomorrow to discuss Special Needs Week. So the information about that, what it is, and the link to join, that's all in the chat. And I believe, going back, I'm trying to make sure I got everybody. Liza had dropped a comment about the other support program services reopening, and the guidance being given to kind of follow the day program reopening for these other services. I think we pretty much touched on that, but Liza, if your specific question wasn't answered, just jump back, let us know.
So, hey, this is Liza. Sorry.
Thanks.
No, I just want people to be aware. I'm concerned that I think the DDD has done a really good job of providing guidance around residential and day programming, but I'm uncomfortable and I'm concerned about the lack of guidance around other support programs that are currently closed. And when I've raised that issue, the direction has been to follow the day programming reopening guidelines that apply to other services. And I think that that's dicey for people that are receiving those services to not have clarity provided by the division about what the reopening guidelines should be specifically for each of the services that are provided by the division that are currently closed and are going to be able to reopen. So, I hope that other people will voice that same concern and hope that DDD will provide that guidance to all provider agencies to ensure that there's clarity about what's safe in the provision of all the division services.
Liza, can you just give us some examples of the other services that you're mentioning that
Sure.
don't have, yeah, just so that I'm clear. Thank you.
Well, so, the ones that come most to mind are the ones that impact the people that we serve directly. So community inclusion is probably the largest one. And even employment services, pre-voc, career planning, supported employment are lacking some reopening guidelines. I think, things like respite has been active throughout the pandemic in a one-on-one. So it's anything that's not one-on-one, any group activity. So like supported employment would be one-on-one. We don't do group employment services, but other people do. So
in those services that you're mentioning, Liza, the screening protocols would be required, screening protocols for staff and individuals, but what you're talking about is the clarity around resuming group activities, correct?
Correct. Yeah.
Okay, that's a good question, and I don't have an answer, and I don't know that anybody else on the panel has an answer, but certainly something that we can follow up with.
Thank you.
You're welcome.
Thanks, Liza. And there's a Lauren, I know, dropped into the chat asking the question, why are we reopening when cases are increasing? And then, when you link to the Cali map, it does look like an awfully red map. And I think that, not that I'm a spokesman for the division by any means or by any stretch of the imagination, but I think part of their thinking was that the reopening wouldn't happen if cases are increasing. If counties are red, reopening in those counties doesn't go forward. it's a slightly different measure than what they've done over the past. When we think about the first round of reopening in the summertime and then the reclosing over the fall and the winter, it was kind of a statewide switch, right? Everybody in the state, you can go. Everybody in the state, stop and go home, right? And it was a lot of families, a lot of providers, all in the mix at the same time. I think their thinking was a little bit more, this is a slightly more flexible approach. If, say, North Jersey isn't seeing any spread, but South Jersey is all in the red, North Jersey, you can go to those services if that's what you want to do. But if the whole state turns out to be red, well, then the whole state's not reopening. It's not like there's a smaller percentage in those counties where the case numbers are growing. So to that extent, there's some logical connection there between those numbers and the colors of the counties and the reopening status on them.
So Michael, before we move over to children, I just guess the other thing to make very clear, and I'm sure most of you already realize this, but there's still going to be a high level of uncertainty, even in the 6 counties, I believe, in the lower part of the state, southern part of the state, that can reopen, because that Cali score changes every week, every Thursday, and a county that is due to reopen on March 29th, which is this Monday, based on that score. If that score changes, the day program has 48 hours to close down, which means that by that following Monday, Thursdays that when the score comes out, by that following Monday, they would have to close again. And so whatever plans you had in place would need to adjust. So that's also a decision point for an individual. Even if the provider says you can come back, I think the individual and family has to consider the uncertainty of consistency in the return. But I know that we want to move on to children's. I don't know if you're ready for that, but I just want to make sure I point that out to folks.
Yeah, my 7:40 was my kind of mental cutoff point to switch over. So we've got 2 more minutes, which basically means 1 more question. Either Jill, if you've seen anything come in on questions or in the chat. I haven't seen anyone new in the chat yet. Or if anyone wants to unmute themselves, this is also your chance.
No, nothing in the questions box, but I would love to hear from people if they're comfortable unmuting.
Okay, hearing nothing, I'm going to move along now to the next slide, which is really just a reminder for us on where we stand here. We have a 2-point topic of discussion. We're now going to move on to children under 21. So this would be young adults ages 18 to 21 or children under 18, people who would fall either in the educational entitlement period or into the children's system of care. And similar to adults with DD, we're thinking with children with DD, a couple of just kind of, these are talking points on things you might have thought of. The one piece of advice I have to add on my, general information that was helpful for adults with DD for this population is for folks looking for the vaccine. If you end up looking towards Autism New Jersey, I know there are some vaccines that are approved for children as young as 16 years old, and there are eligibility groups open now for children as young as 16 years old with certain health conditions or who fall into other populations. That pilot program is pretty clear that they are working with people who are ages 18 and up. So just keep that in mind. It's, good not to send yourself down a rabbit hole where you might not find what you're looking for. If you're looking for vaccine availability for someone who's ages 16 or 17, double check with Autism New Jersey before you try to set that up. You want to make sure that may change, but right now, as of today, when I checked it, they were serving folks 18 and up. Again, with that, that's my one piece of advice to add on to this group. I want to hear from folks, again, whether we're in the chat, whether we're in the emails, or whether we're going to unmute ourselves. I think it would be fantastic to hear from folks who are, live here. I yearn for the days when we sit around a table or stand in a big room and talk to each other. So hearing people is always good for me. And just to give you an idea, I'm going to talk for a minute while people maybe get up the gumption to push that mute button. Something that we had heard pretty early in the children's world when it came to services for people with DD were the restrictive visitation policies, where parents were really struggling to maintain a good connection with their kids who are in a residential program, or they felt like the restriction policies that did allow them to keep that connection were just too tight. And I know that a lot of that has changed. I know that they were expecting, and Mercedes, correct me if I'm wrong, I don't think we've seen yet the newest guidance from Department of Children and Families on this area, but we're really waiting with bated breath.
No, that's correct, Michael. They have not yet issued their guidance, but it is in review to be issued on visitation and residential settings for children under 21.
I'm also curious to hear about, schools and a year later, if anybody's in a better place as far as maybe the hybrid learning, or maybe back in school part-time, in person, if it's any if it's gotten any better than it was early on. I know some schools are in the process of reopening. I have family members that are very happy that some of their schools are reopening, so I'd be curious to hear if anyone has.
I see Bree turned on our camera. Maybe she wants to talk.
Yeah, I apologize. I was shushing my son. Where we are, I'm in Evesham Township in southern New Jersey. But I need to be quiet. Okay, but I need to be quiet for 1 second. Sorry, y'all, my coworker. We've had.
I am your coworker.
We've had a relatively easy time in our particular district with reopening. There's been some 2-week closures here and there among the 7 schools in our district, but overall it's been very positive. There were definitely some, things that missed the mark in terms of special education. One of the main ones is that a lot of push-in opportunities that would normally be opportunities for inclusion were snapped, because now kids are in the classroom watching their gen ed peers on a screen because they're not able to mingle with their classmates physically. For me, who has a deep passion for inclusion, that was one of the more frustrating aspects to what's been a generally successful reopening. The other thing is that, I work in Camden County, though I live in Burlington County, and from school to school and from district to district, things are just different. Some very large districts are just opening now. Some small districts have been able to do okay. And, when all the dust settles, a big concern is compensatory services. How are families who have children with an IEP or a 504 going to make up for some of this time that was lost, really through necessity, because virtual OT is a difficult thing. Virtual PT is a difficult thing. My fear is that the only families that are going to be able to access compensatory services that are going to be meaningful are the ones that have kind of the knowledge and the money to fight the school district. And the ones that don't have either of those things, could potentially have children who are going to be, struggling for some time to come to get out of this COVID hole. And I didn't mean to go on that long of a tangent, but that's kind of where all the feelings there, at least down here.
So Bree, I would absolutely invite you to send questions or concerns, or to direct people who have concerns about compensatory damages to Disability Rights New Jersey. I'm going to be honest, it's not my area of expertise, but we do have, attorneys at Disability Rights for whom this is their area of expertise. And actually they're working on some projects right now with our national partner, NDRN, around compensatory education, and trying to get some self-advocacy materials prepared, but also provide, direct representation. So, certainly if you need it, but spread the word, because that is an area that our special ed team has been focused on really since last April, but they've sort of revved it up again. I think everybody realizes exactly what you said, that compensatory education is going to be a significant issue as we come out of this pandemic hopefully come out. I don't want to jinx us, so I have to knock on wood,
Yeah.
right? So, but yeah, clearly a really important issue, and we are paying attention to it at Disability Rights New Jersey.
Yeah, and if I can be a weirdo and throw in one last thought, I was really very surprised at how lacking the services through the COVID crisis have been for out of district placement programs where schools are spending upwards of $150,000 a year to send children for specialty services who haven't seen a teacher with their eyes in months, who are getting sent home packets, whose schools have just completely closed and aren't able to provide. No one expects services to be exactly what they are when you're there in person and the world is perfect. But, considering that, the decision was made to send a child and segregate them from the public school system to these specialty schools, I kind of expected a little bit more out of their COVID response. I've been surprised and very disappointed to see their response.
Yeah, I think that's something that we've heard, I think on our first town hall that we talked about education. I'm just kind of thinking back to some of the messages we heard, and compensatory education was one of the first big concerns we heard, right? So exactly what you're saying, Bree. And then, the kind of scattered approach because of the way we work with our school districts in New Jersey and how different every district might handle a particular issue, how some might be fantastic, go above and beyond and really provide everything you could ever imagine you could do in this world, and some maybe not. So it does make it pretty tricky. I'll echo Gwen. It's worth saying again, contact our intake office. I'll put the information up on the slides at the end here so that you have the phone number. Spread it loud, spread it wide, make sure everyone knows that we can, try to answer their questions, talk to folks about their individual situations. That way we can do that in a nice confidential setting.
And I would say that, keep an eye out both on our COVID website as we start rolling out some of these materials over the course of the spring. And also just a little sneak preview that we have a new website coming soon at some point in the spring, before the end of spring, which I guess is the end of June. We're not quite sure when yet, but then there will be a lot of these materials on our new website as well. So keep an eye out there.
This is Mercedes. I think it's also important to reference a bill that was introduced in mid-February, Senate Bill 3434 with a Assembly Companion Bill 5366, which requires boards of education to provide special education related services to certain students exceeding age of eligibility for special education, which basically would give students another year, especially those transitioning students who have not been able to participate in any of those transition activities in this, or many of the transitional activities given the remote and hybrid models available in the school systems. So I think, if a bill like this were to move forward, then it would potentially, be able to eliminate some of that request for compensatory services if a full year of special education services could continue beyond that final year of high school entitlement or final year of school entitlement. So something to look at. It has moved pretty quickly. It was voted, I believe, it was reported from the Senate committee with a second reading on this past yesterday. And it was voted yesterday with a 12 to nothing count. So if this bill moves through, and I would encourage people to take a look at it and write your Senate and Assembly members, if this is an area of interest for you, to help move this along. I think this could be quite beneficial, especially for those senior graduates, and maybe cause a little less work to DRNJ, at least for that group.
Thank you, Mercedes. When I look back at the chat here, and again, if anyone is in the room wants to unmute, put themselves on video or not, you can also unmute yourself and stay behind that name plaque if it makes you feel more comfortable. Feel free to do that. I'm just looking back at the chat, and I saw from Natalie Svitek that there's a question about transportation and how there were few options even before the public health emergency. And it might be one of those big problems that helps people get back to normal or a big hurdle between people getting back to normal is the lack of transportation. And whether there's any advocacy on the topic with DDD. Natalie mentioned that she's trying to work and listen at the same time, so I probably can't ask her to come off of mute and tell us a little bit more, unless Natalie, you feel like you've got a second, your boss isn't looking. Don't get in trouble. Because I would like to hear a little bit more. I know obviously we always have concerns about lack of providers. There's a lot of services that are in the DDD waiver program that aren't always readily available, or maybe there's one, or maybe there's even 0 providers in the state that actually fill those needs. It's always a concern of ours. And getting to the root problem is, again, something that we think about, and I know that DDD thinks about as far as modifying rates. I've got one piece of feedback for that, and one of those things is that the big waiver, without getting into the technicalities of it all, the comprehensive waiver for New Jersey is actually going to be up for renewal over the next year. And in June, the state will be proposing to the federal government the terms of the waiver. That's the way that the state gets all this money to provide all these services. Everything through DDD is waiver funded, comes with some federal dollars from Medicaid. So there'll be some opportunities to comment and to give feedback to the state on what's working in the waiver and what's not working in the waiver. So stay tuned, listen out. If you hear the words 1115 comprehensive waiver, that's what we're talking about. That provides for managed long-term services and supports, Division of Developmental Disabilities Supports Program, and the Community Care Program. It also provides for some of the children's services in the children's system of care, kind of goes across the gap. So if you've got a concern like that, keep your ears peeled. Announcements will be coming out from Disability Rights New Jersey. I'm sure the Council on Developmental Disabilities will have things to put out as well, letting people know when comment periods open up. So make sure that your voice is heard if you've got something like that to say, that there's a service out here that is few and far between, it's not working for one reason or the other. That's your chance to speak up and let people know.
Hi, this is Natalie. Yeah, thank you for referencing the waiver renewal. I think that is a good moment to capture and maximize. I guess my concern is as providers are beginning to open up, the lack of, just acknowledging the lack of options for transportation. And I know that there's been discussion at the division for a long time about reimbursing for like Uber and Lyft cards, but I haven't seen that come through. I don't know if there's any movement on that. That would certainly help. But I also just wanted to try to make the point to the group that this is something that I think needs to be addressed and needs to be amplified, because I know I work at a provider agency, and we've tried to work it out where we can expand transportation services, and it's just prohibitively expensive for us. So I don't know how private companies are making it work, but it is such a vital service. I just want some attention, or I want to see some attention to that. Or if there's a way that I can voice this in another platform, please advise. Thanks.
Perfect, Natalie. Yeah, and I think we all hear you loud and clear on that one. So that's something that we can start adding to our advocacy efforts and maybe be a little bit more concerted about transportation. So appreciate you bringing that to all of our attention too. And definitely, like again, 1115 waiver comments are going to be a good time to talk about, even before the public health emergency, things that weren't working in the Medicaid world, DDD, managed long-term services and supports, good form to talk about it. AJ, I saw you turn on the camera. I don't know if you wanted to chime in. Nope. Okay. Hey then. Love your office. Looks great. Sweet guitar back there. All right. I'm looking at the clock. We've got 5 minutes left in our hour that we have for our virtual town hall. So that means time for maybe one more quick question. If anyone saw anything in the chat that I missed. There's some good resources about SPAN's self-advocacy resources. We talked about transportation. I don't think I missed anything else.
And, after a year of Zoom calls, I'm hoping everybody does know how to do this, but in the event you don't, in your little chat box down at the bottom right, there's those 3 little buttons. You can save the chat if you want to save it to your computer and go back and look at stuff later. Lots of resources, lots of links were dropped in here. So that would be a good thing to do, is just save that chat and you can go back to it anytime you need to go back to it.
Good tech tip. Thank you, Jill. Yeah, definitely save those resources. There's good stuff out here. I've picked up a few myself. With that being said, final thoughts. From my end, at least, I want to thank all the participants who came out. I know there's Zoom fatigue at this point. We're more than a year into this, and people are on all kinds of virtual meetings. You sit in front of a screen probably for too much of the day, or for too many nights in a row after you get home from work. So appreciate you all taking the time to help us steer our efforts. It's important for all of us at the DD Partners to know where our efforts are best directed, and we can't do it without you. So thank you. Thanks to Jill for all your help checking up on the emails, for Mercedes and Colleen for helping out with the questions and preparing the presentation for tonight. Thank you guys too. And for my boss, Gwen, thanks for picking up a few questions. I appreciate all of your help. It's a team effort for sure. I'm going to do a little plug. Oh, go ahead, Gwen.
No, I'm just saying good night to everybody. Thank you so much for coming.
If you're all interested at all, it's something that I found personally has been very helpful, is going outdoors during the pandemic. You can get away from folks, do socially distanced exercising, maybe even just, sit in front of a tree and think about quiet thoughts for a minute, and it can be kind of centering. The Pinelands Preservation Alliance is running a series of webinars. One of them is going to be on April the 6th, and yours truly will be helping them host it because they seem to really like these town halls. I don't know why. So mark your calendar for April 6th. You'll be seeing some announcements come out. Disability Rights New Jersey will be rebroadcasting those. If you see one of those events, what we're really looking to do is hear from folks with any kind of a disability, whether that's a developmental disability, like people maybe who are on this call, maybe somebody has a physical disability, maybe some kind of a mobility challenge, maybe somebody deals with mental health issues. We're looking to see what barriers exist that prevent people with disabilities from getting into the great outdoors. So the goal of the project is to inform landowners and land managers of the state or private landowners how they can make the Pinelands more accessible for people with disabilities. And I think there's no time like the present to think about the value of the outdoors. If you are a person with a disability, you're a family of a person with a disability, or you just know of some barriers that would prevent somebody with a disability from getting out there, we want to hear from you. So again, keep your eyes peeled. Announcements will be coming out very, very soon with the sign up link for all that. So keep that in mind. That's my final thought. As promised, I'm going to put up our contact information. This way it shows up in the recording right at the end. And there'll be the slides available at our website, which is drnj-covid.org. The information on your screen is our intake information. There's a toll-free telephone number. There's a TTY. You can reach out to us by fax if you have a fax machine, by email at advocate@drnj.org, or our website, drnj.org, has an intake form. So if you have an individualized question, if you're looking for our assistance on a particular problem, if we can't help you, we probably can point you in the right direction of somebody who can and give you a good bit of information and a solid referral. Feel free to reach out to us. Don't hesitate. And with that, I'm putting up our social media. If you want to follow us on Twitter, follow us on Facebook. Again, there's our web addresses. That way you can keep up with the latest future town hall events for ours or related town halls you may be interested in. Please subscribe. Don't forget to click the bell. All right, everybody. I hope you have a good night and a pleasant good evening. Take care.